Good afternoon, everyone. We have with us this afternoon Dr. Joe Toledo, who is a medical doctor with a specialty in infectious diseases and public health. He currently works at a Pan American Health Organization regional office in the emergency department as advisor for clinical management of infectious diseases and infection prevention and control. Dr. Toledo will speak to us this afternoon on the rational use of personal protective equipment and management of health workers exposed to COVID 19. Dr. Toledo?
For some of you who have already attended a couple of our webinars on IPC, this is a slide that I always like to bring to your attention because when it comes to the implementation of IPC measures in healthcare facilities, we are aiming to, one, to limit the human-to-human transmission of any infectious agents. Infective agents, they have the ability to to cause disease in other individuals besides the index case. So implementing these measures will reduce secondary infections, and more than ever, and most importantly, in the context of COVID-19, that we know that health facilities can become an environment where the infection can be disseminated. If we implement on a timely manner these IPC measures, we will reduce the transmission through the amplification events and also super spreading events that are very particular in the context of the coronaviruses and the SARS-CoV-2 as well. This is a report that was launched by WHO in the beginning of April of this year, trying to bring or even assess the burden of COVID-19 infection among healthcare workers, no, in the context of this pandemic. At that time, our region, no, the region of Americas, occupied the second position in the rank of regions, no, because we were the second region most affected by COVID-19. Certainly today, these figures have changed. Because we are facing a high increase of the number of, we are contributing to the number of cases of COVID-19 worldwide, but at that time, healthcare workers accounted for almost 5% of total cases reported to WHO. And these figures make us think of what would be the occupational risks for infections, no, in healthcare settings. This WHO report brought a couple of points, like the late recognition or suspicion of COVID-19 in patients, because sometimes health workers might not be aware of the disease, no, or might not be able to recognize promptly at the points of entries where patients seek care of suspected cases, or because health workers work in high-risk departments or units, for example, intensive care units, emergency rooms. We also have the constraints of the human resources in terms of shortage of healthcare workers, leading to healthcare workers working for longer periods of time. And then we have the whole issue that I would like to discuss with you today. It's that the compliance to IPC measures, no, including hand hygiene, and also the misuse or improper use of personal protective equipment. But there's also the concept and also the other side of the coin that it's not only a matter of having or not having personal protective equipment, but health workers, they need to be trained on the use of these personal protective equipment. And finally, another another factor to exposing health workers to the burden of COVID-19 would be longer exposures to large number of COVID-19 patients due to the fact that we are facing widespread dissemination of the disease. These are some figures that I'm bringing you here. These are the figures that were updated 1 month ago, and I would like to bring you your attention to the number of COVID-19 cases among healthcare workers. And here we have the figures presented in terms of proportion of total cases within countries that are of healthcare workers, and at some point, it's difficult to make an interpretation of the data because we are comparing different denominators. No, one thing is to compare a country with a small proportion of individuals to a countries, for example, like Brazil or Mexico or even United States. But this is only to have you an idea that countries are facing the burden of COVID in health workers. And at the same time, health workers, likewise the community individuals, will can have the death as an outcome for the COVID-19 infection. So this is on the right. What we have here, it's the case fatality rate among COVID-19 positive health workers by country, and it is difficult to establish comparisons because we are dealing with different denominators, but this is just to bring your attention to the fact that we are facing both infection, COVID-19 infection in healthcare workers, and one of these outcomes would be the death. The same report by PAHO also brings the age and sex distribution of COVID-19 among health workers in our region, and the dates present the data presented here. It is similar to what we are observing in other cohorts, for example, the European cohorts in Italy, Spain, which means that most of the health workers are of the female sex and ranging from 30 to 39 years old, even 40 to 49 years old. This is also a paper and a slide that I always like to present in our webinars to bring your attention to the fact that COVID-19 can be acquired either in the healthcare facility or in the community. So this is one of the first papers that was published by the Chinese group of experts that were facing the first cluster of COVID-19, and the idea, the way that the paper was presented or was designed, they couldn't draw conclusions in terms of risk factors of the reasons why health workers became infected by with COVID-19. But the idea here is to highlight that in this cohort of almost 140 confirmed cases of COVID-19 in that specific healthcare facility, they had a significant proportion, almost 40% of these individuals acquiring the infection within the provision during the provision of care, no, and also health workers were involved in this cohort of individuals infected, not only non-health workers. So it's important to have these in mind because, and as I mentioned before, the health facility may act as a catalyst for the increase in the number of cases and also the perpetuation of the chain of transmission of COVID-19. And then the researchers are also and keep trying to find out or to investigate the reasons for healthcare workers becoming infected with COVID-19. And this letter was published specifically to the Chinese context. But if we think besides the context of the Chinese situation, the reasons they present can apply to any country in our region, either because we are facing inadequate use of personal protective equipment, or countries, Ministry of Health, healthcare facilities are facing lack of personal protective equipment, and even this word shortage of PPE, healthcare workers exposed to longer periods of times, leading to pressure in terms of the load, the burden of cases, no, the higher workload, leading to stressful situations that Dr. Caetano will address on her lecture. And also important, and I think this is the time to discuss with you, because it's interesting to have the discussion in terms of the reasons for health workers becoming infected with COVID-19, but we need to step back and think what could be these barriers, no, to the compliance to good IPC measures, no? And one of the key challenges is that countries are still facing challenges with implementation of their national policies on IPC measures, and these policies can be translated into guidelines. The problem is that these guidelines, most of the times, they lack in terms of content, or the content is inadequate for the care of patients, or rational use of personal protective equipment. When we think of healthcare workers, we normally think of either a physician or a nurse, but we forget of the community health aides. We forget of the respiratory therapists, and we also forget of those in charge of cleaning and disinfection in the health facility. So this group of individuals might not feel represented in these guidelines. And again, the access to PPE, it's a problem to the implementation of these SOPs or even guidelines, and the compliance with the adequate use of personal protective equipment. That is a complex situation, because it will involve not only the technique, but also behavior changes. And finally, in terms of papers and data, I'd like to bring you this paper that was published, I think it was in the last week of July. It's cohort of healthcare workers in the United States and in the United Kingdom. What they did, the authors did, they compared the risk of COVID-19 among healthcare workers and with the general population. And major conclusions of this study: most of the individuals of the female sex health workers presenting any sort of comorbidity, either diabetes, hypertension, or patients, health workers with smoking habits. Those health workers working in intensive care unit or working in a hospital ward, and again, being either a nurse or a physician or a respiratory therapist were also involved in the in an increased risk of acquiring COVID-19 in healthcare in a healthcare facility. This the continuation of that table that I presented. I'd like to focus here on the final four rows of this table, because health workers, they presented signs and symptoms specific to, well, not only specific to COVID-19, but they presented signs and symptoms of acute respiratory illness, like cough, sore throat, fever, and shortness of breath. There are also reports of dysgeusia or anosmia that are currently considered as hallmarks of COVID-19 infection. But it's what's interesting here in this paper, and this paper was conducted in United States and the United Kingdom. If you pay attention to the testing for SARS-CoV-2 for acute infection before serological testing, like half of these health workers couldn't be properly tested, and I think, no, it's here. The median of days between the report of symptom and the time from onset symptom to the collection of any kind of lab result took 30 days. No? So this is a challenge that will lead us to the second part of this lecture in terms of how to proper manage health workers. When we think of infection prevention control measures, we are thinking most of the times on the use of personal protective equipment, but the use of personal protective equipment should be understood in this concept of the hierarchy of controls that we have to implement. Elimination controls, for example, cleaning and disinfection, engineering controls in terms of ventilation controls, organizing patients into wards, the administrative controls, for example, establishing a triage system for early identification of patients, and alongside the use of PPE, because the use of PPE per se is one of the least effective measures in terms of containment of any infectious hazard. We need to understand the use of personal protective equipment alongside these other controls, which will lead us to the famous concept of standard and transmission-based precautions. Whenever we are taking care of a patient with an infectious disease, regardless of the status of the infections, we need to comply with this standard package of measures, which include hand hygiene, the use of personal protective equipment according to the risk that that myself as health worker will be exposed in the context of COVID-19, respiratory hygiene or cough etiquette, safe injection practices, sterilization and disinfection of medical devices, and environmental cleaning, alongside the implementation of transmission-based precautions that in the context of COVID-19 will include the implementation of contact and droplet precautions and the airborne precautions in case that we are performing aerosol-generating procedures. And just as a reminder, this risk evaluation and infection prevention control relating to the use of personal protective equipment will depend exclusively on the type of interaction with the patient, the amount of body fluid that is going to be generated within this interaction, and finally, the mode of the transmission of the disease. I'm not going to enter into too much details in this slide because I think I'm running out of time. And for the a couple of remarks in terms of the general principles on the use of personal protective equipment. We always need to comply with the hand hygiene practices according to the 5 moments of hand hygiene. Those personal protective equipment that we see that it's damaged or even it's broken, we needs to be replaced. No, because if they are damaged or broken, we will not be fully protected. As soon as we finish the use of a personal protective equipment, they need to be properly doffed and also discarded on an appropriate bin, and perform hand hygiene after removing the personal protective equipment items. As I mentioned to you, and I recommend you to have a look on these scientific brief on the modes of transmission of COVID, SARS-CoV-2 and the implications for infection prevention control. And Dr. Steinpluk is including these links on the chat. What we know as of today is that we have 2 well-established transmission routes for COVID-19. The virus can be transmitted either through respiratory droplets or through contact in the interhuman contact. We keep the transmission of SARS-CoV-2 through airborne particles whenever health workers are performing aerosol-generating procedures like mechanical ventilation, nebulization, bronchoscopy, necropsis, and hyperoxygenation ventilation, for example. It was ventilated, if you allow me the word, a couple of weeks ago, the role of pre-symptomatic or asymptomatic individuals in the transmission of COVID-19. The transmission of COVID-19 by asymptomatic or pre-symptomatic individuals is unclear as of today. There are a couple anecdotal reports of this transmission, but further investigation is needed, and we need to think that we are facing widespread dissemination of the virus. So it is important to have well established and implemented triage systems and screening of suspected cases rather than focusing only in asymptomatic or pre-symptomatic individuals. I have just mentioned the AGP for you. I'll leave the slides for you later. In terms of the requirements and technical specifications for the use of personal protective equipment, we at PAHO have adapted and developed our own guidance focused to our regional needs. We have developed these communication materials that you have access on our website with instructions on donning and doffing personal protective equipment. And we have also tried to to present the information on a more fashion way in terms of level of care and the use of personal protective equipment. The key message here is that whenever we are performing an AGP on a patient with suspected or confirmed case of COVID-19, we need to focus on the use of a respirator, either N95 or FFP2, or depending on the place, FFP3. No, for the other individuals that, or for the situations that we are performing triage of individual, or for example, if the national policy is to recommend the use of a mask, for example, a surgical mask would be enough. This information also, in terms of the use of personal protective equipment, is related to those in charge of procurement of PPE and also the decision makers, no, because they need to guarantee an adequate supply of PPE in health services according to the recommended specifications. We also have developed a document for the technical regulations and specifications for personal protective equipment, because we know that there are a lot of counterfeits in the market, so we need to be aware of these falsified PPE. And as I mentioned before, it is very important to know how to don and how to doff personal protective equipment, and this will require training and education on site. These are also communication materials that we have developed, and it's on our PAHO webpage that you can easily adapt to the local context. I would like to focus specifically on the respirators. I'll just, because this is one of the key challenges that we are facing right now in terms of the use of respirators, because we are facing a shortage of these personal protective equipment. And as key messages, to have these personal protective equipment for those who really needed to use it, which means health workers, we need to know how to optimize the availability of these equipment. No, either minimizing the personal protective equipment need, use the personal protective equipment on appropriate manner, and also coordinate the supply chain for the personal protective equipment using either national, international, or regional mechanisms for procurement. In terms of the optimization of the use of PPE, we have these three major concepts. No, we can, if we are going to reuse the personal protective equipment, we can either extend its use, we can reprocess the personal protective equipment, or as a last alternative, we can try to have an alternative item for the personal protective equipment. I'm not going to go into details in this table. This is a document that was produced by WHO. Dr. Steinpluk and myself, we have participated in the discussion of these documents. The key message here is that there are some items in the personal protective equipment in the context of COVID-19 that we will not be able to reuse after an initial use. No, either because after a couple of hours, a surgical mask or a respirator becomes moist, or there's maquillage on the personal protective equipment, or we don't have validated techniques to to reuse, to sterilize, or to disinfect. No, for some of you who had the chance to attend one of our webinars on the reuse of medical masks, um, the expert that presented her experience on her healthcare facility explained it to us that when she received the personal protective equipment, in that case it was the respirator, she could reprocess less than 25% of the respirators. And there are a lot of also challenges in these technologies. First, because they are very expensive, they are not available easily, and there's a lack of standards in terms of local regulations on reuse of these medical devices, and most important, there is no validated protocols for the reprocessing of these equipment. No? This is a document that we have adapted to the context of the region of the Americas. I really recommend you to have a look on this document because it provides some key aspects in the and challenges in the reprocessing of respirators. And the key message here would be to focus specifically on the rational use of personal protective equipment. And then for the management of health workers exposed to COVID-19, there's a couple of key documents that were released in the beginning of the year, trying to assess the risk of these health workers. The knowledge that we had in the beginning of the year, it's different in terms of the knowledge that we have today, in terms of the viral dynamics and also the availability of lab testings. WHO has released a guidance about the care for health workers exposed to COVID-19, CDC as well, and we as PAHO, we have adapted these guidelines to the context of the Americas. No, we have this document that was released in the middle of April for the care of for health workers exposed to COVID-19. The focus of this document, it's a document that will focus on 3 levels of decision, including the type of exposure, the type of monitoring according to the level of exposure, and the presence of signs and symptoms of acute respiratory illness. You haven't heard myself saying until now testing of health workers. First, because we know that countries and health facilities are still facing challenges in procuring these tests, and we also have a lot of counterfeits in the market. No, and the idea here is to focus on the type of exposure of health worker rather than universal testing, because we know that although this would be the ideal situation, no, we don't have tests available on a universal manner. So the idea here is to focus on the type of exposure of the health worker. Briefly, a health worker who had contact with COVID-19 in the past 14 days, we need to define what is the type of exposure, if it's a low-risk exposure or a high-risk exposure. If this is a low-risk exposure, it's the health worker that provided care to someone, either a suspected or a confirmed COVID-19 case, but was complying with the rational use of personal protective equipment, regardless of the clinical activities. On the other hand, the high-risk exposure we would define as a close contact, no, with this health worker with a case of COVID-19, either in the community or in the home or even in the health facility, or a health worker that was providing care to a COVID-19 patient without proper use of personal protective equipment. So this is the first thing, the first thing that I have to assess, the type of exposure. Then I have to define the type of monitoring according to this level, according to the level of exposure. If I had a low risk of exposure, I can recommend to my health worker the self-monitoring of signs and symptoms. And in case I start presenting fever, sore throat, muscle ache, or any signs and symptoms related to COVID-19, I have to report to my supervisor. On the other hand, for those health workers who were exposed to a high-risk situation, we need them to be more active in terms of monitoring of signs and symptoms, and the health facilities should keep track of these high-risk exposed health workers. And for those health workers with high risk exposure, they need to be restricted on work activities for 14 days from exposure. And finally, the presence of signs and symptoms of acute respiratory illness. If you still remember the paper that I showed you on the cohorts in the United States, health workers or non-health workers, if they become infected with SARS-CoV-2, they will present signs and symptoms of acute respiratory illness: fever, sore throat, loss of appetite, muscle ache, shortness of breath, and also lack of tasting and smell. These health workers under high risk exposure to COVID-19, they need to be restricted from work, and then I have to test for COVID-19. This test being positive or the test being not available, I will refer this patient to a COVID-19 treatment unit. No, this healthcare worker exposed to a high-risk situation, if this test is negative, I will have to investigate other causes of this acute respiratory illness. And finally, if the healthcare worker was exposed to a high-risk situation of COVID-19 but does not present signs and symptoms of acute respiratory illness, I will recommend the continuous monitoring. It is also important to not forget, for those when we are caring for health workers exposed to COVID-19 in health facilities, to comply as always with the standard precautions that I had mentioned before. And this is a summary of what I have presented in the flow chart. I won't get into details because I think I passed my time already. And finally, this is the form for self-monitoring or active monitoring of the health workers exposed to COVID-19. This is my last one. Sorry for exploding my time here. I'll stop sharing my screen and I'll take questions. I think we will have a Q&A session by the end of the webinar. Thank you very much.
Thank you very much, Dr. Toledo. We'll now move on to a presentation by Dr. Claudina Cayetano on mental health and psychosocial support for the healthcare professional. Dr. Claudina Cayetano is a psychiatrist. She's a psychiatrist with 25 years of experience in mental health service delivery. She currently works as the mental health regional advisor for the Pan American Health Organization and is based in Washington, D.C. In this role, she provides technical cooperation to PAHO member states, particularly the Caribbean region, in all matters related to mental health as a public health issue. Dr. Cayetano, welcome. Please go ahead.
Thank you, Dr. Harris. This is such a pleasure to be doing this presentation with you, and then actually joining Dr. Toledo. I'm really pleased that we have done this before, so I'm really pleased that we have this opportunity to work again together, Dr. Toledo. I like how you have brought this, presenting the physical part of the importance for healthcare providers to understand the, how to prevent and minimize the impact of the, minimize the infection. I heard the comments from Dr. Gandhi. I'm so pleased that she was also able to join us, and from our colleague, Ms. Valeska. So thanks for the opportunity to present to you and talk about the mental health and psychosocial support. I think one of the things that happen when we talk about mental health, we want to make sure that everyone that this has to be clear for us that is important that everyone has mental health, just like everyone has physical health. It's unfortunate sometimes that when we say mental health, people think disorder, and that's not what we are talking about here. It's as important as taking care of your physical health. COVID seems to be more like a physical condition, but then it does affect the anxiety, the worry, impacts your performance. So just like you can have a good physical health, at the same time you can have physical illness. So people can have good mental health, and at the same time they can have a mental illness. So this is something that we want to make sure. But then to be able to have a clarity on that, because unfortunately when we talk about mental health, we tend to think, we use words of crazy or stressed out. The language that we use tends to then create more difficulties. So here we're talking, it's important to think of three components of mental health. And this slide came from one of our, recently we had a project with Dr. Harris and from Ministry of Education in Jamaica and the Ministry of Health, where we had a program for teachers on school mental health literacy. And this is one of the slides from that program, because the idea here is to capture this literacy on when we say mental health, what do we mean? When we say mental distress, what do we mean? And what do we mean when we say mental health problems? Because most times people don't think distress or problems, people think disorder. And this is what we want to avoid that. So I think we want to make sure that I go to the next one. So when we talk about COVID and what is the implication for health programs, it's not just the impact on the population. Dr. Toledo had mentioned to you about the infection when it comes to healthcare provider, but even when we talk about mental health, in this case for mental health, we also want to, they have done some survey in the U.S. where, over 45% of people have, this has affected negatively on themselves, their mental health, due to the worry, due to the stress over this virus. The same thing when we see Brazil. I'm not going to stop, and, I just want you to see that more than half, are saying yes when they do their survey. They have psychological distress, and then they have experiencing anxiety and experiencing some other moderate, some severe depressive symptoms. So this is important to keep in consideration. And when we talk about mental health workers, similarly situation even in our setting, in our region, in the Americas. So you're seeing that people having high levels of anxiety, of insomnia, of distress, and then what we call a compassionate fatigue. Getting extremely tired, and this, the impact of depression, anxiety, insomnia has an impact on how they take care of themselves. Actually has an impact that in terms of having a higher rate for accidents, in terms of making more mistakes, in terms of they reduce their concentration and their motivation. So they have some, this research again to show that very high level of impact on their mental health. And this is study in Canada saying 47% of people said that they would want to have some kind of psychological support. Now, when it comes to alcohol, then yesterday our colleague Marisela Montero presented a presentation on finding on the survey that was done in the region, in the Americas, where there is a high consumption of alcohol. And believe it or not, they also find that there is a high consumption among the among women. So, and with the quarantine, with the lockdown, people are not going to the bars, but they tend to more, have drinks at home. And then today we had a Facebook Live where one of the guests was talking about, where people sometimes used to have this thought that alcohol um, can cure COVID. So all this misperception. So there has been some research to show that there's an increase in alcohol consumption. So here I'm talking about the Canadian research, but we have done research in our region to show that this is a problem here too. So the next slide has to do, so what does this mean? What did COVID bring to all of us? It brings, all these psychosocial challenges. So when you say mental health and psychosocial support, because of these psychosocial challenges, so we need to be able to think of the importance of psychosocial support, changing in work arrangements. I always tell people of the blurredness in terms of, you have before we used to work in our office, now you have to work at home, so you have to have a room only for that. And if you have family members with whom you have to be sharing the space or sharing, and if sometimes maybe it's not sharing the space, having different space, but if one is louder than the other, so all of those challenges, all of those work arrangements can be very difficult and stressful. And the school closures, the disruption of essential services. And when we say, when we say essential services, it's not just primary care, it's not only about health, but even people who are working in other, pharmacies. I think Dr. Toledo approach talks about these different, when we talk about healthcare providers, but even when we talk about essential workers, it's people who are there to support the work that others at different levels are doing. As I mentioned, working from home is not the same as going to an office. Our home is to be where we should be relaxing and enjoying, our family. And now that's, becomes our office. And for some people, it's not only that, because we know of people who have lost their businesses, who have their job, reduced earning, and then the travel restrictions. So these have an impact on your mental health. And so, of course, when you talk, this has been mentioned before in previous presentation about increased workload, because what happens too is that not everyone, sometimes people want to do more overtime and people want to do more, because now if you have other people who before were working, let's say in health centers, now they will bring them to work in the essential services. So all of these changes within the work system affect people. And then additionally to that is that they don't get a rest period. So working very long hours with very little time to rest And then this worry, the constant worry about getting infected. And if they get infected, they bring the infection home to their family and friends. And we know that in many countries, what they have done is to provide people, like, with a hotel close to work, so that they stay for 2 hours, for 2 weeks, and then after that they take a time out to go back to their families. And sometimes they also been working on providing transportation. So I know that there is work there's that good work that is happening in the Caribbean in terms of making sure that there is a support for healthcare providers. And as it was mentioned before, the issue of in protective measures. If it's not in place, we are in trouble. And when you're working from home, I mentioned that the blurred boundaries between work and family. If you have small children, that can be really taxing, very taxing on the family, because they're not going to school, they are home, and then, so they have a different schedule. So when you not don't have a family, small children, if you have adolescents, similarly, or if you have your older parents that you need to look after. So all of those things are important. And of course, living when you have small spaces and you're not used to working together like you did before, so that increase some tensions, the communication. So there is reports on increase of domestic violence. So, and then people have this fear of losing their job, pay cuts, layoff, reduced benefits. So all of this brings a lot of job insecurity, and this can impact your mental health. Now, the role of the brain, I think I just wanted to quickly come over that, because this is important to realize that it affects our how we perceive things. We know that our brains help us, about our thinking, our behavior, our cognition, our perception, our senses, our emotion, and our feeling. So all this, the signaling in terms of when there's something that is not well. So we get signals, and sometimes the problem many times is that we're not reading the signals as much as we would want to. So we want to make sure that people have that clarity. You take time to understand that, the way our brain works is sending us the signals, and to be able to stop. And so what happens is that when we talk about mental health problems, this is because there is a stressor. So it could be that, the issue of COVID is a stressor. So when faced with this stressor, everyone can experience negative emotions. When we say negative emotion, we're talking about, mental health problems like your thoughts in terms of your thinking become more distorted, having more negative thoughts. And then you can also have a physical discomfort. People have more like headaches, gastric problem, behavioral changes when they become more irritable, impatient, and so when they get like this, they get negative in terms of, nothing good will ever happen to me. I don't know if I can go on with my life, and I'm having all these physical problems, like sleep or appetite. So these are mental health. Remember, I said problems. I didn't say disorders. I said problem, because this is not a disorder. This is just a problem. This is just something, or reaction to a situation that is abnormal. And specifically when it comes to COVID, because of the anxiety, it's so overwhelming, and so it causes very strong emotions, not only on adults or healthcare providers, on children, adolescents, and adults, everyone. And this is because it's an outbreak that is affecting, it's worldwide. So it has an impact on you as a human being, on your appetite, on your sleep, concentration, on your problems, chronic health problems, worsening of mental health conditions. And then, as I mentioned before, if people are not careful, they start to increase their use of alcohol, tobacco, or other drugs. So this is why it matters so much that we pay attention to our mental health. Because if we don't, we tend to ignore the signs, the problems that affect, it's impacting us. So it's good to have that distinction between when we say acute stress and chronic stress. When we talk about acute stress, we know that it's a reaction. Sometimes people say, well, this is beneficial to move. The pressures from stress can help us to go and then push through situations that are nerve-wracking and intense. If a stressful situation is short-lived, because we are resilient. People can be resilient. If it's a short lived, we can return. So you get stressed, and then you go back to your original state. So without any negative effects to your health. And so this could be what we call acute stress. Your resilience is if a stress is activated repeatedly over a period of time. So here we're talking of the impact that this has to your body. You start to feel overwhelmed, and then this can become because you have more and more. Imagine like a vehicle that you're just adding more and more load to it. So it starts to get slowed down, it starts to become affected. And so this is what we're starting to talk about chronic stress. And when there's a chronic stress, some people don't realize the impact of this chronic stress. Damage to your blood cells, vessels, and arteries. That's when we're talking about, increasing on your blood pressure, increasing your heart rate, having more chances for heart attack and stroke. And we talk about elevated cortisol, and this elevated cortisol, notice sometimes that people start to gain more weight and they start to become sluggish, and again, and it becomes like a vicious cycle. Hypertension, diabetes, high blood pressure, all of those things are important. And we sometimes, even though healthcare providers have this chronic stress, sometimes they're not aware that this comes because of the way how they're coping with stress. So it's very, very important that we pay attention to those things. And when we're stressed out, many people, this is what happens, they cannot focus, they get angry. And then we say, oh, it will be okay. This is how this one, No, this is not okay. It's an opportunity to stop and say there must be other ways we can do to cope with this. They get very, they're restless. Some people start to cry or they get sad or worry. These are the things that we tend to see in terms of changes in the appetite. And some people ignore these signs and pretend that if everything is fine. And what that is doing to us is that this is not going to be healthy in terms of helping us to find ways to cope. Many of us think a lot about bad things from the past or bad things that we fear in the future. So all of these things just, get you to do things that are not good for your health. So the negative thoughts are so impacting, are so powerful. People, when you go fishing, and that's what you see there on that slide, people get hooked, and they get hooked to this negative behavior, negative thoughts, negative thinking. And so when you get hooked to something, then it becomes harder for you to see something different. That's what becomes your way of looking at life. So we have this slide is from one of our other presentations in terms of telling people, okay, how do you unhook yourself? What do you need to do? Because remember, your thoughts has influence your feeling, and your feelings influence your behavior. So when you get hooked in this thing, you get hooked on negative thinking, negative behavior, negative feelings. So this is what we want to avoid. Okay, so I think if you can write in the chat what we want for you to, as part of the work that you're doing in your role, do you think that it's important to care for your mental health, especially during this pandemic? Yes, no? It will be good to see what we have in the chat in terms of what the people think, whether it is important to look after the mental health. Yes, thank you. That's what's important. It's definitely important. And you could continue saying why do you think that's relevant. But clearly what we're saying here is that as part of your activity of daily living, when we say activities of daily living, we're talking about, you get up in the morning, you go to the bathroom, and, you have to brush your teeth, you have to wash your face, you have to, some people need some coffee before they even do all of that, but, that's important. This is like you do it automatically. So automatically, we want you to start to take time to look after your own well-being, okay? And it will be good to know what people are doing to look after their own well-being. Believe it or not everyone takes time to do that. And so it will be good to hear, what do you do to look after your well-being? What are the things that matters to you every day? And I'm not, remember I said active daily living? This is not what you're going to do on a Thursday night or eat Friday. No, this is what you do on a daily basis, okay? So if you're saying, so on a daily basis, what matters to you? I see someone say rest and then exercise. Okay, but do that. Actually, pay, do that. The good thing about now we have apps that helps us, that tells you, well, today you only done, I don't know, 5,000 steps, and my daily is 8 or 10. So you want to make sure that you keep doing that. Do that, because that's really important in taking care of yourself. And why this taking care of yourself is important? Yeah, I like this spending quiet time. Thank you. You're right. Quiet time, exercise. Just listen to your breathing. Just listen to your heart rate. Just stay still. Those things are, believe it or not, are very powerful. And why do you need to do that? Well, you need to do that because in the same way that a car needs fuel to drive, you need to look after yourself and keep your tank full so you can keep going. If you're going to be helping others, if you're going to help in this response, you need to be able to stay well. Remember when we used to fly, they will tell you, before you take care of yourself, before you take care of others beside you, you need to put on your oxygen, or, if you're a parent, it's very difficult. Like for me, I would think, well, I want to do my, take care of my daughter first. No, no, no. You take care of your son. You take care of yourself first, and then you take care of others. So this is very important. When you take care of yourself, that means you're there, you're focused, you can take care of others. So remember that, okay? It's sometimes very hard because we don't know how to do that. We are thinking of others, we're not thinking about ourselves. So very important that before you look, you can help others, you need to look after yourself. Okay. Learning how to manage your mood and your anxiety. This is very, very important because you need to identify practical ways to structure your day and promote these healthy habits to increase your positive mood, and that helps to reduce, this withdrawal, this negativity. So you want to explore importance of self-care, doing things that you find that really matters to you, really how you talk to your partner, your colleagues. Managing your thoughts and your feelings is so important, especially now, because I mean this is having a tough time for most of us. So having this helpful communication, to avoid conflict, so to minimize it as much as you can, and then reflect on how do you use your time. It's an opportunity for developing resilience. How we used to cope with, you want to be able to be resilient, especially in this time. Start or continue. I was mentioned, someone mentioned about exercise. There's resources online. There's videos. There's yoga, meditation, things that you find can help you to stay well. So we in PAHO has, if you go to PAHO.org in our website, we have a lot of tips that we can provide in terms of we have done to provide for help for people to take care of themselves. As I said, first, how do you take care of yourself? What do you need to do to take care of yourself? The importance of listening to your body, talking to someone that you trust, and of course, avoiding unhealthy ways of coping with stress. Eating too much or drinking, alcohol or some, or doing those things that doesn't really help you. So you want to be able to avoid those. And when we say tips for your own mental yourself, you also want to take care of yourself. We're talking about healthcare providers, but ultimately, when you come home, it's your family that is there for you, right? Remember? So you need to be able to take care of your relationship. What your anger warning signs, what makes you to react, what makes you angry. And again, you also want to be able to surround yourself with people who are positive and then have that attitude of gratitude. I think that's definitely very important. So in terms of protecting your mental health, we know this is a very stressful time. So these things I mentioned before in terms of making sure that you do things that are going to help you to stay healthy, to stay well. So what do we want? We want you to manage your mental health and psychosocial well-being during this time as important as you manage your physical health. That's what we want, okay? We want to make sure that you try these helpful coping strategies to ensure, as someone has said before, to ensure that you have good rest, that between shifts, you rest, and that you make sure that you also are in contact with your families and friends. And as I mentioned before, avoid everything that is not healthy, that doesn't take you to protect and promote good health. Everyone, I think that's our responsibility to ourselves. We need to pay attention to their own well-being and to the well-being of our staff. And so this is not a luxury, okay? This is actually a responsibility. So I really like this opportunity when when we're doing this webinar, where we actually take time not only to talk to you. I think for us from PAHO as a health agency, we do value that you learn what are these guides and importance of protecting yourself, but not just in terms of protecting your physical health, but actually protecting your mental health. So my last is just to tell you thank you. And as I say, we have a long way. So I was in a webinar the other day, and people talk about this back to normality, but they say, well, even before we were not, what normality? We were not normal anyway. So I don't know, but I still believe that we still have a long way to return to how we were. So, but I think together we need to make sure that mental health is on the agenda. Together, let's make mental health everybody's business. So thank you for the opportunity to be in this webinar. And I also want to tell you that today, September 10th, is World Suicide Prevention Day. So again, it's very important because we are also seeing an increase of suicide in our region. So thank you, and here for questions. Back to the moderator. Sharon.
Thank you, Dr. Caetano. Thank you, Dr. Toledo, for these two excellent presentations. We cover how we keep our body and mind safe from this during this pandemic period that is a challenge for everybody. So I'd like to remind you, please post your questions on the chat. We already have some questions for the first presenter, Dr. Toledo, and I really encourage you to also post questions to Dr. Caetano about mental health and cope mechanisms and so. Dr. Toledo, I believe you can see some of the questions. So the first one is about the recommendation for sampling of healthcare workers for COVID when they are working in the high exposed unit or isolation area, how frequently and who need to be swabbed.
Thank you very much for the questions. I could see a couple of questions here, and I'm also checking the other questions. I think we have a group of questions related to sampling of not sampling, but testing of health workers. No, in the context of COVID-19, we have to understand two situations. The situation that I mentioned, that one, we. When I say we, countries and health facilities are facing a shortage of and also access to lab diagnosis for COVID-19. We have a lot of counterfeits in the market that makes it more difficult to implement a comprehensive strategy on universal testing, or at least testing health workers. In terms of the viral dynamics of the virus, we have a long way ahead to understand how the virus behave, and depending on the methodology that we are going to use to test either a health worker or a healthy individual, for example, we might come across positive results in terms of serology or even RT-PCR, for example, that we might not be able to fully guarantee that the result is true positive. No, this to say that the message in terms of health workers and testing for COVID-19, the current recommendation is to not offer universal testing for these health workers. If you remember the flow chart that I showed in terms of management of health workers exposed to COVID-19, the main focus of this approach is not to testing everybody regardless of their exposure status or clinical condition. No, because we don't have these tests available, and sometimes the result that we may find might not represent the true result. So in summary, we don't recommend interval COVID-19 sampling for healthcare workers which are facing high exposure situations. And I think there's a question similar to this one in terms of, I'm just reading here, a health worker who faced a high risk exposure with a positive patient while doing physical examination with a regular surgical mask. No? Again, this would be a low, although he was performing an activity, physical examination of a positive patient, he was properly using personal protective equipment. So there's no risk, there's no need to test this health worker. What we need to propose is to establish a self-monitoring report of signs and symptoms of this health worker, and in case this health worker presents signs and symptoms suggestive of COVID-19, then we need to look for the signs and symptoms and provide testing to this health worker. But I think that another clear message in terms of health workers and testing in the context of COVID-19 is to have well-established national protocols in terms of management of health workers exposed to COVID, and we are keen and willing to help the country, if this is the case, to review guidance and also support development of SOPs for management of health workers. Over.
Thank you, Dr. Toledo. There is also a question about the risk in respect to the air condition situation or use of air condition inside of isolation area, if it's increased the risk, and healthcare workers working in such area need to be tested more frequently. Over.
Thank you very much for the question. I have included here on the chat the Q&A on ventilation and air conditioning and COVID-19 that was released by WHO, and I was also trying to look for these numbers in terms of risk. I don't think there's any paper published on these risk, but I think that the message here is also that, and I know that we are dealing with a Caribbean country, know that it's fundamental to the activities on the daily basis to working under air conditioning. I think the message here is that these systems for air conditioning, they need to be well maintained, no, and most important, these systems, they need to be set to increase the rate of air change and avoiding the recirculation of air in the inside the environment. And again, the route of transmission of COVID-19 is well established through respiratory droplets and also contact. So we need to focus in these modes of precaution rather than investing in the ventilation system. Over. But I have to check here if is there any publication in terms of these risks, but I don't think there's a paper published on this. Over.
Thank you very much. There is a question about the recommendation of wearing face shield in general practice and other staff wearing face shield as well, face mask. What are the recommendations for face shield and face mask? Over.
I don't think it's not. I didn't understand if it's for the general population or for health workers.
Health workers.
Okay. Can I share my? I think we have time. No. Can I share my screen? I think Dr. Caetano needs to give me access, because I think it's with her right now.
Okay, while you are trying to share your screen,
because
there is another question about the release of healthcare workers from isolation once they are positive.
Okay, so for the release of health workers, once patients are, once the health worker is symptomatic and we need to restrict, is this the question, right?
Yes, symptomatic or have been in high risk situation.
So again, this is one of the current recommendations that it's also on our document. Those health workers under a high risk exposure to COVID-19, they need to be assessed in terms of signs and symptoms, and then tested. And if this test is positive, they need to be refrained from work for 14 days. No, because this is the time that it's the current recommendation for criteria for discharge of patients. I'll include here on the chat the criteria for clinical discharge of patients, no, but this also works for health workers. As soon as we finish the time frame for the immunological window, these health workers can return to work. In terms of the use of face shields, they need to be used, and I won't share my screen here, but as part of the use of personal protective equipment, we have to include the surgical or respirator, and then we can opt either through the face shield or the goggles. No, I think that in most health facilities it's easier and more available face shields, and so the face shields would be recommended when providing care for patients with COVID-19.
Okay, and thank you. We have the last question. Can you see it, right?
Yes, and this is a very interesting question, no? Because I don't know if everybody is able to check the question. It's a patient who is in the community and becomes symptomatic. What's the recommendation in terms? Oops, now I lost it. What's the recommendation in terms of navigating this person into the hospital? Well, if this patient is symptomatic, it's part of the concept of standard precautions to offer this patient a surgical mask. No, so if I am in the triage and I am a medical doctor or I am a nurse and I am assessing the vital signs of this patient, and this patient happens to have signs or symptoms of COVID-19, the first thing that I should offer this patient would be a surgical mask to protect and the use of surgical mask as a source control. I think this question has sub-questions. Do you recommend the patient to be assessed at home by primary care physician, they taken to the hospital? This would be an option. No, we know that we haven't discussed here the clinical presentation and the clinical management of patients with COVID-19, but we know that 5% of patients with COVID-19 will be patients will present severe symptoms in terms of acute respiratory illness, severe sepsis, and even septic shock. So these patients, of course, they need to be referred to the hospital. But for those mild cases, these cases can be initially assessed in their home, and then oriented in terms of signs and symptoms of complication, and then referred to the health facility. I will share with you the PAHO document on the clinical management of COVID-19 patients.
Thank you, John. So I think we are over time already. We have one more question in the chat. So, John, if you can take this question. And just as a reminder, the record will be available in PAHO Jamaica Country Office website. And with the presentation, some people are asking for the presentation as well. Thank you.
Thank you very much. I have included here on the chat, if you can, while I finish the answer for the question, if you can click on the link, then you can save this page on your computers or smartphones to have a look later on the technical documents for COVID-19, not only IPC, but also clinical management, emergency medical teams. There's a question here in terms of some individuals being symptomatic for 35 days. I know this study showing that these individuals were symptomatic up to 35 days, but in this study, the researchers weren't able to how can I say this? Weren't able to recover the viable virus, and they are these reports of individuals with COVID-19 presenting mild signs and symptoms, especially symptoms related to chronic fatigue syndrome. Which answers your question. The window period of 14 days of quarantine is enough. And finally, there There's a question for clients who came with fever as symptoms, placed in quarantine, then shows signs of cough. Face shield N95 is required for nursing staff, and that's it. No, but I think that this would be the option. But again, it's very important that health facilities know how to implement triage recognition of cases. No, because even those cases that I mentioned to you, that these anecdotal reports of asymptomatic or pre-symptomatic individuals, when the investigators assessed in depth the signs and symptoms, these patients presented signs and symptoms related to acute respiratory illness. So it's very important to establish these triage mechanisms and in health facilities to avoid losing patients potentially with COVID-19.
I would just like to thank the presenters, Dr. Toledo and Dr. Cayetano, and all the participants. We are very pleased that you've been able to participate in this meeting today and stay for the full length of the meeting. I hope it's been very helpful to everyone. Thank you all very much.